The main goal of our International Chair on Cardiometabolic Research is to empower health professionals, such as those of you who are assembled here, to give you the tools and the knowledge and the expertise that you need to fight cardiometabolic risk. To help achieve this goal, we're very pleased to announce the relaunch of our newly designed website, which provides even more powerful tools and an information bank on cardiometabolic disease. Now, in the first 5 years of our International Chair on Cardiometabolic Risk, we really focused on the problem rather than the solution by emphasizing abdominal adiposity. And to the general public, that doesn't resonate as well as the solution. And so our new website is named myhealthywaist.org, which we believe will resonate with the large public, and that is the way that we think we can make the best inroads in communicating our goals and in changing behavior by engaging the public with myhealthywaist.org. Now, this new title speaks to the healthcare community as well as to the general public, encouraging us all to focus in our daily activities in monitoring waistlines. Now, we know that cardiometabolic disease is not just a medical concern, but it's a critical public health issue, as we've heard. So the new website that we're launching here at this meeting is designed to provide you with faster, easier access to videos, tools, and breaking news on abdominal obesity and cardiometabolic risk. It also features advice for the general public, encouraging them to take use of their own cardiometabolic health. And we find increasingly that our patients are having access to the World Wide Web as a source of health information. And there's so much of the health information on the web that is not authentic, that is not well validated. And so it's very important for organizations like this that are science-based in order to have our share of voice in trying to provide information not only for professionals, but also for the public. So using this new myhealthywaist.com website, you're going to be able to get fast, effortless access to extensive documentation. You're going to be able to keep up with breaking news and research so we can bring it to our communities as leaders in the most rapid and effective manner. And there are going to be many practical videos and educational slide sets to help us get the word out. Now, as you know, the world of cardiometabolic risk is rapidly evolving. New ideas and research come to light with increasing frequency and all over the world. And we see more and more specialties are developing keen interest in cardiometabolic risk. We see not just cardiovascular specialists, but also endocrinologists and pediatricians and nephrologists. Many, many specialists are now devoting parts of their meetings to this issue of cardiometabolic disease and the intersection of diabetes and their particular organ system. So we're equally pleased to announce our new presence in the global social network. You know, we've witnessed over the last few weeks how the availability of the new social media can really affect change. We've seen it in the political sphere, and the challenge to us as medical professionals is to use the social media as effectively in order to change the profile of cardiometabolic risk in our various countries. So we want to help you all keep up with the latest news in real time and invite you to join us in this growing worldwide community on the following networks of new social media whose icons you see on the slide that is displayed here. Facebook. Some people are calling the revolutions in North Africa the Facebook revolutions. So let's make a revolution in cardiometabolic risk on our own. Become our fan and get exclusive access to expert advice, reports from our annual international conference here, photographs and more. Maybe even a few photographs of people running in the Reserva Ecologica tomorrow. We have the slide share to discover slide sets and illustrated scientific data related to cardiometabolic risk and abdominal obesity. On Twitter, we'll have instant method for helping us to follow alerts, breaking news, expert opinions from the world of abdominal obesity and cardiometabolic risk. YouTube, I think that we're going to see some clips on YouTube of the sessions that you have been contributing to here today. So you're going to be able to tune into our educational YouTube channel for conference broadcasts and interview clips with the world's leading researchers in cardiometabolic risk. And on Flickr, we'll be able to share images that include scientific data that are related to cardiometabolic risk. I saw a lot of flashbulbs going out when important slides came up, so let's try and get this material onto Flickr so you'll be able to have access to it and download it easily and spread the word about the control of cardiometabolic risk. And then at the professional networking level, LinkedIn, we invite you to join our international network of health professionals specialized in cardiometabolic risk and to make new contacts in your field of interest. So I'm going to invite you to watch with me a brief video presentation that will illustrate how we are going to
Researchers and physicians consume vast amounts of information. Nearly 1/3 of their professional lives is spent collecting and working with data. MyHealthyWaste.org, an initiative from the International Chair on Cardiometabolic Risk, comes at just the right time. Entirely dedicated to abdominal obesity and its catastrophic effects on health and cardiometabolic risk, MyHealthyWaste.org brings together all the latest news, research, and documentation on this global health problem. Cardiometabolic risk redefines a patient's overall risk of developing cardiovascular disease, but there's more to it than that. MyHealthyWaste.org gives you a concise overview of abdominal obesity as a new key driver of cardiometabolic risk, and explains why the risk increases as your patient's waistlines expand. With more than 1,000 scientific publications organized by author, theme, date, and format, the Documentation Center is a valuable resource for increasing your knowledge and enriching your presentations. Ready-to-use slide sets prepared by international authorities can be downloaded to provide you with immediate expertise. The document you're looking for is sure to be there. A digital innovation presented by MyHealthyWaste.org. Technology, science, medicine, they are spreading across social networks on a spectacular scale, from Facebook to LinkedIn, from Twitter to YouTube. Whatever your time zone, you'll find hundreds of individuals, researchers, and practitioners already following cardiometabolic risk. Take part in this vast worldwide community. Learn who's doing what, ask questions, and offer your answers. Barcelona, Boston, Buenos Aires, Paris, and Shanghai, cardiometabolic risk is everywhere, both literally and figuratively. What about you? My Healthy Waste, for doctors who are ready to take action, starting now.
So that's an example of how our chair is going to be using social media in order to advance our cause. But you know, we live in an era of information overload. We're bombarded on all sides by stimuli, as is the general public. And how do we get our message on cardiometabolic risk out? And how can we do so in an effective way that will actually cause change? You know, we have decades of academic and scholarly research about risk factors, and we've heard about those in the preceding symposia. And we know the importance of abdominal obesity, and we need to incorporate that knowledge into practice and to help it change behavior. Now, how do we do that? I'm sure that in your offices you have on the wall the beautiful colored charts that have been generated by learned committees, people who sit in a room and devise these beautiful colored charts to calculate your risk. So from New Zealand and Australia through to Europe, there are these beautiful paper risk calculators that no one uses. So how do we actually get a tool which will be used? And how will we reach out to that younger generation with the frightening incidence and increase in the prevalence of abdominal obesity? So in order to do that, we're launching at this meeting, as part of the International Chair on Cardiometabolic Risk, the new iPad application, which will be downloadable by free and which will be demonstrated in the exhibition area. And we hope that it will be live during this conference. Now, this iPad application is designed particularly for health professionals in order to have a real-time way of using the knowledge that we have gained about risk factors and implementing it in your practice in a way which will be most effective and will help us to change behavior to promote a healthy lifestyle. And so, to share with you the new iPad application, I invite you to watch with me another short video presentation before we launch into the opening ceremonies.
My Healthy Waist is a free iPad app that automatically calculates a patient's risk level after every visit and after every blood test. That makes your life much easier. The app delivers virtually all of the content of myhealthywaist.org. Plus, it comes with the iBook by Dr. Jean-Pierre Després, professor at Université Laval and director of research in cardiology at the Centre de Recherche de l'Institut Universitaire de Cardiologie et de Pneumologie de Québec. Simple to use. Enter the names of your patients, their consultation dates, and clinical information. All kinds of relevant data can be entered. Now, watch. The algorithms do all the work. You can immediately view your patient's level of cardiometabolic risk. You can save the results, print them, or send them to your clinic, and you can instantly find any patient you're looking for. Comprehensive and effective. My Healthy Waist uses 21 risk algorithms and variables covering 5 different categories: cardiovascular disease, blood pressure, diabetes, obesity, body fat distribution, ectopic fat, and lifestyle habits. Each algorithm specifies risk categories, data needed to make the calculation, exclusion criteria, how to interpret the results, referenced methodology used to develop the algorithm, and bibliographic sources and relevant links on myhealthywaist.org. You will also find useful tips for healthy eating and on benefits of physical activity. My Healthy Waist. Download it free from the App Store and transform your iPad into a smart professional tool. My Healthy Waist. For doctors who are ready to take action, starting now.